Okay, what I want to go over next is how to further secure the patient's airway using what's called an oropharyngeal airway, otherwise known as an OPA. When we're securing the patient's airway without any device, we are doing the head tilt chin lift. Head tilt chin lift is applicable for infants, children, and adults. If time permits, meaning we have extra set of hands, CPR is being performed, 911 has been called, AED is being placed on the patient, the BVM is being used to breathe for this patient, and there's a fifth person involved, then we can consider further securing the patient's airway using an OPA. When we're dealing with OPAs, as you can imagine, there are different sizes of an OPA depending on the patient that you have. So what we're going to do first is how to measure and insert an OPA. As you can see here, this is too small for this patient. This is probably the perfect size for this patient. When measuring an OPA, you would like to measure the entirety of the OPA versus where the lips start to where the ears start. So either where the lips start here to where the earlobe or the angle of the jaw. And you want that entirety to the same size of the OPA. Probably a perfect size. When we're inserting an OPA, we want to make sure that we're inserting it correctly depending on age categories. Infant, children, and adults, we're inserting it differently depending on their age category. Adult patients, ultimately, what we want is we want the OPA inside their mouth so it sits inside their mouth like this. With an adult patient, you do not want to insert following the natural curve because you run the risk of pushing their tongue to the back of their throat. The purpose of the OPA is this bypasses the patient's tongue and it secures their airway, which will prevent the tongue from falling back at the back of their throat. So when we're inserting an OPA for adult patients, there's a thicker part and a narrow part. The narrow part is what you insert inside their mouth. Insert the narrow part of the OPA, scraping their upper palate. What this will do is this bypasses the patient's tongue, ensuring that we are not pushing it to the back of their throat. Once it's all the way in, we then rotate the OPA 180 degrees. So it sits inside their mouth like so. Taking out the OPA, whether the infants, children, and adults are all the same. We are pulling the wide part following the natural curve of their throat. So therefore, I just pull it out straight out like this. When we're inserting an OPA for a child, let's just say this mannequin here is a child, 1 to 8 years old. When we're inserting an OPA on a child, we are not scraping their upper palate because their upper palate is more sensitive compared to their adult counterpart. You do not want to scrape their upper palates because you run the risk of causing internal damage in their oral cavity. They start bleeding, more complications that you need. We are inserting at the side of their cheek, just like so. Once we insert it at the side of their cheek, right when it's all the way in, then we rotate it 90 degrees. And pulling the OPA out, we just follow the natural curve of their mouth. When inserting an OPA with an infant, obviously this is way too big for this infant, a little bit more practical to their size. How do I know? Earlobe, angle of the jaw to the corner of their mouth, just like so. When we're inserting an OPA for an infant, you do not want to insert at their upper palate. You do not want to insert at the side of their cheek because again, you run the risk of cutting the side of their cheek and or their upper palate or bleeding on their oral cavity, more complications than you need. Therefore, for infant patients, you would like to follow the natural curve of their mouth. However, keep in mind, if we're following the natural curve of their mouth here, you do not want to blindly just put it in, thus shoving their tongue at the back of their throat. So if you have a tongue depressor available, my free hand will hold the tongue down to the mandible, hold it down in place, so that way this OPA just follows the natural curve while their tongue is being held down to their mandible. Once it's all the way in like so, we do not have to rotate it because that's exactly how it should sit. Taking the OPA out, same as infants, for children, and for adults, you just follow the natural curve of their mouth, just like so.